Good morning and welcome. Let's allow maybe 5 minutes for people to join. I see we still have people coming in. Thank you. Good morning once more. I hope you can all hear me. My name is Donald Ngonyama. I am the director at NACCW. Welcome to the webinar in the month of July. We are happy to be hosting yet another webinar. I will be the program director for today. And I know that we still have people who are joining. We will proceed and they will get us on the way. Firstly, I would like to indicate that we are starting at 11 and we are expecting to be done by 1 o'clock. If earlier, that will be good. And the purpose of today's webinar is to provide feedback on the advancing appropriate and quality alternative care options for children and youth with the Deinstitutionalization Task Team. You will remember that in February on the 26th, we had a webinar in which we discussed the international campaign that is going around. Also, we have had and felt a bit of a shake-up in our country with regard to the institutionalization. And then the child and youth care sector decided that we should look at taking a position on this matter. And a task team was instituted. People volunteered to form part of the task team. I would like to thank all of those people who have worked very hard since then. There has been a number of meetings that were held by the task team the task team members, and also a lot of work that was done in developing a position paper. So today we are meeting with you to present that position paper. The following people formed part of the task team, and they are Annelie Duplessis from Kids Heaven, Fiona Balgobind, who is the chairperson of the NACCW and also works for the Peter Maritzburg Child and Youth Care Center. Is Dr. Zenith Ambatu from NACCW, Sam Mokhopa from Kids Heaven, John Perman from Kids Heaven, Kurt Jonker who is an independent NGO consultant. He has given an apology. Unfortunately, he's not able to join us today. Martin Stabry, who is from the Child and Youth Care Net, and many of you, I hope you know him. Professor Nick Smeyer, who is Professor Emeritus from the University of Wisconsin in the US, Ndumiso Koyana, and Richard Mfuku, Francisco Cornelius, whom you may have seen a number of times within the NACCW circles, from Lily Bloom Child and Youth Care Center, Mandy Goebel from Durban Child and Youth Care Center, Julie Todd from Peter Maritzburg Child Welfare, and Karen Fed from Girls and Boys Town. So thank you very much for all the work that was done. I think I have not left out anyone of the test team members. So they have done very good work, which we are going to be presenting to the sector today. And it will then move to the next steps. I also want to indicate that we appreciate the attendance of the members of FITSE International who have joined us this morning. We also are expecting members of FITSE Africa. If they have joined, you are welcome. We've got the National Executive Committee of the NACCW who are amongst us, and employers of child and youth care workers from organizations and child and youth care centers run by government and NGOs. You are also welcome. And the friends and supporters of the work of the NACCW, whom we are hoping will be joining us if have not joined yet. And our program for today, it's going to move as follows. We'll get a presentation from Fiona, and then shortly after that, there will be a presentation on the summary of the actual position paper, and which will be done by Annelie Duplessis. And then we will then have comments coming from the members of the task team who are going to be sharing their opinions and views. And also it will be a reflection on the work that we have done. We'll then open the platform for discussion to everybody. And then once we are done with that, there is an assessment of qualifications of child and youth care workers, which we would like to share with you. And then we will have a vote of thanks. We will get somebody from the members of the task team because Herb is not able to join us. And then it will be closure, which will be done by Fiona. And so that is how our program is going to proceed today. And I have welcomed everybody. If you've just joined, feel welcomed. I'm now going to hand over to Fiona to take us through the presentation. Chairperson, thank you.
Hey, good afternoon. Good morning, everybody. Thank you, Donald, for a very detailed explanation of thus far what has happened in terms of progress since our first webinar in February and the various meetings that have happened with the task team. So this morning, I have the opportunity to share with you a PowerPoint which brings together some of the key aspects that are found in the actual draft position paper that we've put together that will be shared after my presentation. So please bear with us as we go through this presentation. I'm going to put my camera off and I'm going to share and then just go through our slides. Let's see how we take it from there. Randy, you'll guide me, or Donald, whether you can see my slides showing. If not, then you'll take over.
The slide is not showing yet.
Okay.
It is showing.
Okay, great.
Maybe put it on a PowerPoint presentation.
Okay, so are we good on your side, Donald? Thank you.
Yes.
Great. So I'm going to take you through a presentation, which is going to give you a synopsis of our actual position paper as indicated, which is a draft. And the purpose of today's meeting is to go through the draft with the general membership in order for us to also share with you what the position paper looks like. And if there are any gaps or any other recommendations that the task team still need to review to add before we finalize this position paper, we would like to do so with your comments after this morning session. So today we are presenting the NACCW's perspective, a child-centered position on deinstitutionalization, focusing particularly on residential care, alternate care reform, and the future of our child and youth care centers in South Africa. As indicated, the position paper is put together with the intention of submitting it to our National Department of Social Development, National Treasury, the Portfolio Committee on Social Development, our provincial departments of social development, and to all our child protection stakeholders. That's my slide moving. Randy, do you want to take over? It doesn't want to move our slides.
Hi, Fiona. Are your slides not moving after you click next?
Yeah.
Hello?
Hi.
So it's not moving?
No.
Okay,
I'm going to stop sharing and let you take over.
Okay.
Great.
Just give me a few seconds.
While Randy is just putting up our PowerPoint again, just to remind everyone that I know I can see a hand up at the moment. Once I go back to my slides, I'm not going to see a hand. But please, as you're listening to our PowerPoint and then later to Annalie, who's going to share the actual draft document, can we ask for everyone to please make your comments, put your comments in writing, either in the chat box or make a note of it. And then when we get to the discussions on the agenda, we will give you an opportunity to share your points and to add on any other comments you would like. Okay. Great. So I'm going to continue with our PowerPoint presentation. We are talking about our sector concerns. So firstly, what we had to do is revisit our context and have a look at what is going on in our child and youth care context. And it is focused on a child protection system already under extreme pressure, as we all know in this room. Some of the important aspects that we took into consideration is that there is pervasive poverty, driving unprecedented demand for statutory child protection services. There are unsustained caseloads. Social service professionals are stretched far beyond safe capacity. And severe court delays. Children's court processes are backlogged, delaying safe placement decisions. So in this fragile context or environment, the sector is responding to DST's mention, and we emphasize the word mention because we haven't seen a formal document from DST to date, of rapid downscaling, defunding, and closures of registered child and youth care centers under the banner of the word and the concept being used called deinstitutionalization and the Targets 2030 agenda that we've heard of. The department's current direction increasingly treats the reduction of residential care capacity as an end in itself, conflating highly regulated therapeutic residential care with harmful, routine-driven institutionalization. Okay, we're going to move on. So what we are saying in effect is that we are fully aware of the context. We're fully aware of the challenges within the context of child and youth care and aware of how it impacts on the services rendered to a particular child. And in summary, the gist of what we are saying, or the quick synopsis, captures some important components that we think that were important to be putting into the actual draft document. So it is not enough to say that children should grow up in families. The real question is whether a suitable family-based placement exists, whether it is safe, supervised, funded, and whether it can meet the child's needs. And some of the important components we added was that NACCW advocates for a child-centered system, balancing family strengthening, prevention, and reunification with high-quality regulated residential care. NACCW opposes any policy that treats the defunding, downscaling, or closure of child and youth care centers as an end in itself. A lawful child protection system cannot rest on a single preferred placement model. It requires a full continuum of care, and we'll talk a bit more about the continuum of care as we know. South African law takes absolute precedence over unbinding policy aspirations such as Targets 2030. So in saying this, which is our stance as NACCW, we also want to make it very clear that our standpoint, as we presented to DST, giving them almost what it is, our expectations of DST. And some of the points that we highlighted there was that if, together combined, NACCW and all other like-minded organizations who support and endorse our final position paper will be looking to the same intention from DST. And what are we saying to DST? We are saying before closing, downscaling, or defunding any CYCC, the department must show province by province data on funded operational alternatives, maintain immediate after-hours crisis placement capacity, guarantee measurable safety and stability standards, and present a fully costed phased transition framework. So that is part of our recommendations to DST on this. Move on. Okay, so we're going more into the position of NACCW. So NACCW is making it quite clear that it is not a defense of institutional care per se, but it is a defense of children's right to appropriate care. And we obviously advocate for good residential care in whichever capacity or wherever it is found. The constitutional question is direct. When a child is removed from family care, will that child have access to safe, lawful, stable, and appropriate alternative care on the day that care is needed? So NACCW supports strengthening families, prevention, early intervention, and reunification, essential parts of any child-centered system. And as you know, quite a few of our programs under NACCW are focused on strengthening families and doing preventative and early intervention work. So we're not denying that that is equally important and relevant in the field that we work in. NACCW cannot support treating the reduction, defunding, or closing of CYCCs as an end in itself. And for some children, we need to acknowledge, especially where family care is unsafe or foster placements have failed, a child and youth care center may be the most appropriate form of care. And any deinstitutionalization policy must be evidence-based, properly costed, adequately funded, and clearly implemented. So this is coming through very clear in the draft position paper. Next. Okay, some of the core position statement that we make, and we hear this all the time in our field, is that what we offer in residential care or in the field of care of children is a continuum of care. And when we speak of the continuum of care, we are very clearly saying, that we don't function isolated. Not one component functions independently of the other. We are all dependent on each other in terms of how we function, how we support each other with the programs that are offered for the best interest of any child that comes to us. So a lawful child protection system cannot be built on a single preferred placement model. And part of that continuum of care looks at prevention and family strengthening. It looks at reunification, kinship, and foster care. It then looks at specialized therapeutic family care. And at some point then it looks at residential care and child and youth care centers as the alternative option if the other options have not worked. And then eventually, obviously, looking at aftercare and independence of children that were part of any of the systems. Children enter care with vastly different histories, risks, and therapeutic vulnerabilities, and all 5 stages must be funded, connected, and available, not treated as competing models. So that's one of the key components around our discussion with DST, is that we have always had a continuum of care in our country, and residential care is one key component in that continuum of care and should not be sidelined or what is a better word for it, reconsidered in a different light in terms of failing to acknowledge the years of proper quality service that has been offered in residential care over the years in South Africa. And in many instances, residential care was one of the key options for alternative care right from the early 1800s. So we do believe residential care in South Africa has a big say and has been around long enough to understand the nature of the work and the nature of the children that we receive. Okay, we'll move on. So what deinstitutionalization should mean? So here, the question of what do we do and how do we understand the word deinstitutionalization was raised. How do we interpret the meaning behind deinstitutionalization is a concern, because as we always know, when we sit down with DSD, we have our own interpretation of a document or policy or a word even like deinstitutionalization, and it would be totally different in terms of the understanding from a DSD perspective. So in terms of our perspective, we needed to be clear, what are we saying in our interpretation of deinstitutionalizing? So we understand that deinstitutionalization should mean elimination of harmful institutional practices, ending unnecessary residential placement, removing poor quality care and weak oversight, and preventing avoidable separation from families. And it should not mean removing regulated therapeutic child-centered child and youth care centers from the care continuum, reducing capacity as an end in itself without funded alternatives, equating all residential care with institutionalization, and treating children in care as an administrative category. So we are clearly saying, as part of our concept note, that this is how we would define deinstitutionalization and what we don't believe it is. We're going to move on. Okay, so we looked at, and this is one of the reasons why it took us a little bit of time as the committee to put together the draft document, because we had the first and second kind of drafts, but we realized that we also need to really bring in the Constitution and the legal framework. And we're thankful to Annalie from Kids Haven for putting the extra effort and time into coordinating and doing the homework around the different legislations and how it impacts on the service delivery for children. So we've incorporated different aspects of this, and Section 28(1)(b) of the Constitution guarantees every child the right to family or parental care or to appropriate alternative care when removed from family environment. The child's best interests are paramount in every matter concerning the child. And in terms of our Children's Act 38 of 2005, it reminds us that it gives practical content to the constitutional obligation that we have, a statutory framework for children in need of care and protection, foster care, temporary care, child and youth care centers, and children's court oversight. So in broad legal framework and in legal terminology, we want to highlight that we are quite clearly demarcated there, quite clearly specified as one of the alternative options for care. Child and youth care centers are therefore not peripheral welfare arrangements. They are critical, rights protective anchors within the statutory child protection architecture. And a policy direction that weakens child and youth care centers must be assessed against the department's constitutional and statutory duties, and it cannot be justified by broad policy language alone. So as you know, we have not had a clear document coming from DST around deinstitutionalization. We've heard bits and pieces and seen other documents linked to it, but it is important that we are proactive in our understanding of this actual document and concept of deinstitutionalizing, and for us to break it down and understand the meaning behind it to be putting together this draft document. So I'm going to move on. Again, we focused on the best interests of our individual children. And here we are emphasizing, when we looked at this policy as well, this concept of deinstitutionalization, our question is it in line with the best interest of the individual child? Okay, because that is one of our guiding principles, core principles involved in working with children. So the best interest principle does not support a blanket rule for or against any care setting. A child-centered system must avoid two important errors, both of which can harm children. And we're highlighting these two specific ones related to deinstitutionalizing. Placing children in residential care unnecessarily. So gatekeeping must be strengthened so children are not removed from family care where safe, suitable support can preserve the family environment. Poverty alone should never be a reason for a child to enter care. And number two, removing residential care where no safe alternative exists. Some children have experienced serious abuse, repeated placement breakdowns, trafficking, or acute risk requiring immediate protection. Their needs cannot be met by policy preference alone. So what we're saying very clearly is that from history and from experience from all of us in the task team, we identified that these are some of the key issues is that there is not proper monitoring in terms of children being placed into residential care, and that could be more more strengthened in many different ways to avoid children coming into the system if they don't necessarily need to be in the system. Okay, I'll move on. Okay. So if you can recall, when we did the February webinar, we also did a presentation to guide you on what is the global perspective on deinstitutionalization, just to give you a broad idea before we talked about the South African context. So again, what we are highlighting over here is that there are international standards, and these international standards support a continuum of care. The UN guidelines for alternative care of children do not require the abolition of all residential care. And we need to emphasize that very clearly in our statement to DSD. They require that alternative care be necessary, be appropriate, be rights-based, be individualized, and subject to review. The risk against that, the risk of premature reduction of CYCCs. So if CYCCs are reduced without first building sufficient alternatives, the risk is predictable. Children will remain in unsafe homes. They will move through unstable informal placements, cycle through repeated placement breakdowns, or disappear from effective oversight. And that would not be deinstitutionalization. It would be a systematic abandonment of our children. That is a very strong point, and it came out in our webinar in February, where we had presenters from overseas also share from other countries who went through such a process and started to reduce numbers of child and youth care centers, where later on they realized that it actually was not to the benefit of the child in need of care. And so much later, then people have to then go back to the drawboard and review and reinvent the wheel and start again. So we are saying, let's not prematurely make decisions and throw comments out, that we still need to verify and understand better and see whether it complies and fits in with the type of policies and legislation that we do have, and ensure that it is within the international standards, ensure that it is meeting the best interest of our children in care. And these are some of the questions we have and some of the highlights we are putting into the draft policy. I'll move on. Okay, so the role of child and youth care centers in a child-centered continuum. Very clearly what we're saying there is that child and youth care centers are not beds, buildings, or facilities only. And we do know sometimes it's interpreted as that. But at their best, we are rights protective care environments. Some of the key components, and not all of it is listed here, but safety and daily care, emotional containment, therapeutic programming, educational continuity, family contact planning, reintegration preparation, is some of the key components that we offer in residential care. Poor practice must be addressed and quality monitored, but the answer to poor quality care is better standards and stronger oversight, and not the removal of a necessary placement option. So I think what we are saying quite clearly is that if the department is the one who is supposed to be mandated to monitor and play that oversight role, they have a key role in monitoring the quality of services that are being offered. And if there is a need to improve and better services, then that is the role where DST comes in terms of supporting any alternative care option or organization that is rendering a service that is not up to standard. Because our stance is very clearly that we will support alternative care, but we also have a high expectation that those in line with providing services to our children in alternative care are complying and also making sure that they meet the right standards and the norms standards, or the right level and quality of care that should be provided to our children. So we're not negating what should be offered. We are saying very clearly that part of their role function is to support and to monitor, and that in hindsight, it should not be left behind and ignored. I'll move forward to the next point. Okay, so another component linked to the best interest of children, which we raised in our draft policy, is on child participation. And as we know, with child participation, it's also a key component, a key principle that we apply. Children must be active participants in decisions about their own care. Participation cannot be reduced to a formal interview. Some children express themselves through behavior, play, drawing, silence, and attachment patterns. Children should understand why they are in care, what decisions are being made, and how their views were considered, even where those views cannot determine the outcome. A policy developed without hearing children in care or its caregivers or the child and youth care workers, social workers, and families will lack legitimacy and practical accuracy. So if we want to take this forward and look at what are we doing in terms of a further policy as DST would like to, these are some of the key issues we would expect to happen, is that there is proper child participation and there's proper participation and engagement with all role players involved in the sector to fully understand and grasp different aspects related to it before decisions are actually made in terms of policy and protocols being put together. Okay, next point. Okay, then we look at the fiscal reality and risk of unfunded reform. As we already know, we are overburdened in the sector, and so it is not enough to assume that family-based or community-based care is cheaper. Or why would we say something like that? Because we know when we talk in the field, everybody automatically in a room would say the most expensive service is residential care. So we would be the easiest one to consider reducing or cutting down if we are looking at a reduction in funds and reduced funding to the sector. But our question is again asking very clearly, let's not make such an assumption that family-based or community-based care would be cheaper. Poorly supported family placements can fail, and failed placements will carry costs for children, for caregivers, for courts, for social workers, schools, and health services. Grants are not services. Wanted to emphasize that point. Social grants are vital and must be protected, but cash transfers do not replace a statutory child protection service. A caregiver grant does not by itself provide therapeutic support, supervision, emergency placements, family assessments, or court reporting. So we cannot put those together and say it would work if you provide simply grants out there into the community or into the family and anticipate that it will all work and fall into place. Where must the funds be invested? We've put together some ideas where we do believe that it will strengthen the sector in terms of what we offer to our children in need of care. And some of it is that this funds, if it had to be put elsewhere and invested in an appropriate manner, it can be invested in child and youth care workers and social workers. It can be invested in prevention and family preservation services, in kinship and foster care support, emergency placement and after hours capacity, and children's court support and monitoring, which is needed. Okay. And as we know very clearly in the field, there are many, if we just look only at the department itself, with their cuts in funding, they are reduced to lesser social workers, lesser capacity, lesser manpower, lesser resources. And that questions whether we do believe family-based or community-based care would be a cheaper option, because you also have to consider that to run good, proper, and to maintain and to ensure quality family-based and community-based programs, you still require a lot of resources. You require extra manpower and support and extra resources in terms of all other aspects like vehicles, phones, offices, in order to make sure you're offering the best service that you can to ensure that all the services are sustained and maintained out there in the community. Okay, we're going to move. So what we looked at as a task team is that if we have to review this concept of deinstitutionalizing, what would happen? What would need to happen? Or how do we foresee what's going to happen if DST want to really, revisit this concept? And one of the key things we said is if it has to be reviewed in relation to anything, it should be reviewed in relation to research and to evidence. And part of the recommendations that we are putting forward based on our own research as a task team and the feedback that we've got from our legal capacity is that we should be able to put forward something that we can give to DST to say this is something you should be doing before you review anything. So the 4 tests for any deinstitutionalization policy is clearly marked here. Every policy, target, or implementation plan must satisfy all 4 before it closes, downscales, defunds, or redirects children away from child and youth care centers. Now, we know what happens in the field. We've seen it happen over the years. In different provinces, we've seen DST shut down, literally shut down child and youth care centers purely by reducing the funds that they give to a child and youth care center, cutting down their bed spaces, cutting down their administrative costs, reducing the numbers, ultimately means it affects your staff capacity, it affects how you're functioning and managing your operational expenses as a residential care facility. And all that will eventually make you make a call whether you can survive or not in the current financial climate. So in effect, it may not be an immediate response, but if they do cut bed spaces and other subsidy amounts to a CYCC, in effect, you are shutting down a facility long term. So we asked ourselves again what this criteria would look like. And part of this criteria that was brought together was capacity, safety, quality, and implementation. So what we've got there is province by province data on real funded operational alternative placements, not just an aspiration. Under capacity, under safety, the second test is around immediate placement capacity, clear crisis protocols, and protection during the transition. Under quality, measurable standards for safety, stability, attachment, education, and well-being. And under implementation, a funded, governed, and realistically phased transition plan, not a target date alone. As we know, they have put down a target date for this process to have complete or started. Okay, so these are the 4 tests that we have put in place, recommending to DST that this is some of the things you should be doing first before you even think of closing, downscaling, or defunding or redirecting children from child and youth care centers. Next. Okay, so what does NACCW propose? A child-centered alternative care reform process based on 6 commitments is what you would find in the draft document. And these 6 commitments are listed as: adopt a true continuum of care approach, prevention through aftercare as connected parts of one system, to strengthen gatekeeping so children are not removed from family care where safe support can preserve it, to never deny residential care where it is the safest, most appropriate placement for a child, to apply quality standards across all forms of care, both in family-based and residential alike, and to strengthen child and youth care centers through investment in therapeutic programming, staff training and support and data systems, and lastly, to add capacity before removing it. Reform must be phased, evidence-based, and jointly developed. So we are putting our commitments and our recommendations forward in this draft document. Okay, our next point. Thank you. So this is just to conclude our immediate request to the department. So what we've given you is a synopsis of what's in the actual proposed, the draft position paper. And when Annalie goes through it, you'll be able to see it a little bit more clearer as well, how it comes together into the draft document. But we have some immediate requests to the department, and we're sharing this as this is part of our next step after today's meeting. Moving forward, NACCW requests that the department engage the sector through a structured, transparent process, confirm the policy position, which is our first concern, to clarify the intent on child and youth care centers, and confirm they remain a lawful part of the alternative care continuum, to establish a national forum or a consultative platform with DST, provinces, NACCW, child and youth care centers, and all other relevant parties that need to be part of such a structure to take this matter forward, to share the evidence base. As we know, the concept of deinstitutionalization, especially in the South African context, came from another organization's research, and our question was, we would like to have that shared information, the shared evidence that was used for that document, the policy documents, the research, the data that was used, the funding assumptions that were interpreted, and the implementation plans province by province. So we would appreciate if we receive some of that to help us understand their thinking around this concept. And to protect existing capacity, to safeguard current child and youth care center allocations until safe, funded, and monitored alternatives are fully operational. So that's what we're calling for very clearly, is that we don't expect to have more CYCCs slowly but surely finding themselves in a difficult position in different provinces of having reduced and cut funding, which can, debilitate them in many ways and lead to a sudden closure. We would like to see proper, transparent processes being followed, and processes that do comply with certain regulations and legislation as well, in terms of the procedures that are followed for such processes to take place. So with that said, this is just a brief synopsis of what comes from the actual draft position paper. I'm going to end here and say thank you to everybody for listening in. I hope you are making your points and keeping your points very clear for us during the discussion. But what I will be doing is, if you missed anything here, when Annalie is presenting, you'll be able to pick up from her presentation as well, some of the key aspects in the position paper. So please do make your comments and write your points down. We do want to incorporate any of your comments and feedback, as we want to finalize this document so that we can move forward with further deliberations with DST. So we thank you for that, and I'm going to now hand over back to Donald. Thank you, everyone.
Thank you very much, Fiona, the NACCW chairperson. I think that was quite comprehensive. We felt that we would like you to see the document that we are going to be presenting to the minister, and everybody indicated there. And then at the moment, we are not in a position to be sharing that document. We would like it to be submitted first. But of course, after, we hoping that you will use this opportunity today to make inputs, and will ensure that your inputs are integrated. I'm now going to request Annalie to share the document. Just talk to it, because a lot of what was presented by Fiona, in fact, almost everything that was presented by Fiona comes from that document. But we would like you to just get the sense of it in a much more in-depth way. Annalie?
Good morning. I'm sharing my screen. I don't know if I'm sharing it correctly, because I cannot see it, but I'm hoping that you can. So I feel like Fiona did a really great job of taking us through the most important points. But what I'd like to do is just perhaps highlight some of what she's already covered, and then just give us perhaps a more condensed version of the position paper. So what we really did was we really centered this paper on the child's viewpoint. So we really looked at this paper from a child perspective, and then we really firmly anchored it within the South Africa's constitution and the statutory framework. So we also know that Section 28 mandates certain appropriate alternative care options. We know that CYCCs and care workers are seen as essential service providers, and this then guarantees that every child has the right to appropriate alternative care, specifically when they are removed. And this is really what the paper does. We anchor this position within that right. So as we do that, we really position the child in in the forefront. The most important aspect of this whole discussion is, of course, the child's viewpoint. So when we look at withdrawing residential capacity without establishing safe or funded alternatives, we're really not looking at reform, we are looking at systemic abandonment. And what we really did was we looked at our experience and we really positioned our experience and our capacity within this legal framework that also speaks of the Children's Act, specifically Section 150, as we all know. So the question really is, and Fiona also touched on this, is what is it, what is out there, what does it mean to have suitable family-based placement, or what does it mean to have a family that you can then depend on? What does it look like if you don't? And really, we are not saying that children shouldn't be in family situations or families shouldn't be looking after children. We are really saying that when that falls apart or when that is not an option, what do we do? What is available? So we're not saying that we need to defend this. We are saying every child has the right to appropriate or alternative care. So the constitutional mandate is actually very clear. It is very defined. It is there. It is accessible. We understand it well. When a child is removed, they must immediately be able to access a safe alternative. So we're not really looking at administrative categories. We are really looking at children who need very specific care or really specific placements. And this must be individually assessed. This really needs to prioritize the child's safety and the developmental needs and the unique well-being of each child. This is also exactly what Fiona touched on in terms of the paper. We really are saying that families should be strengthened. Families should be available. Families should be available when children need to go back. So we are looking at reunification. We are looking at prevention. We are looking at interventions. But we're also considering kinship, foster care, and all the other community-based models that are out there. So we can actually say that we have this continuum of we have this basket of services or continuum of care options that should be available. And it's not for us to say this is constitutionally mandated. This is exactly what every child needs when we are looking at how can we protect, how can we preserve, how can we develop, how can we guide this child. So it's really about supporting this whole basket of care options. We cannot look at it in isolation. So this is also why we're saying we're not defending one position. We're saying we're looking at children as rights holders. We're really looking at a policy direction that doesn't necessarily exclude one, but then perhaps supports the whole basket of services that we know that we need, because children are different. Children have different needs. Children have different developmental stages. Children just need regulated care options that speak to their individual or behavioral needs. So this is really what the position paper is about. And when we look at the system and when we look at the alternatives around the system, we really need to understand the role of the facilities and the care workers within the system. We are not looking at just physical facilities. We are really looking at specific therapeutic, educational, or protective environments that are specifically bespoke or tailored to meet children's needs and also where they are. These programs meet children where they are. They provide support, they provide routines, they provide interactions that are much needed for children's well-being, but also their developmental or their unique needs. And this is really what the focus needs to be. We need to be focusing on monitoring the standards and addressing poor practice. No one is saying that bad institutional care is a good thing or that should be sought after. No, we are saying that it needs to be monitored. And this is also why it needs to be registered and why it needs to provide oversight and also have specific standards. This will also then make sure that not only are children's voices heard, but the role of the facilities and the care workers within the system is properly regulated. So really it is about not removing an essential service or removing one to be preferred to the other or to be compared to the other. It's really about focusing on the legal or the constitutional rights of each and every child. So like I said, each placement must be justified in terms of that child's needs. It is very specific, it is very regulated, and it's not just about placing a child, it's really about meeting the criteria that we speak about. And the position paper really highlights this. It's really about seeing the role of CYCCs or alternative care as a statutory protection within the system. It's actually part of the architecture. It's so ingrained, it actually cannot be removed at this stage. And there's a reason why it is very necessary for us. So really what we are looking at in the position paper is very clear. We're really looking at a child-centered system that places children at the forefront, that really does not place children unnecessarily. And it's really about looking at a basket of services and really about looking at what is available. If this falls away, what can we do? And of course, like I said, it is really about leaving no child out of the conversation. So we looked at recommendations, as Fiona said, and this is really a dialogue. This is really a collaborative effort to come together to talk about what the options are, what the capacity is, what the safety needs are, and what we can do together to implement a care system that looks at all of these things. And it's really about assessing capacity at every level. It's really looking at the available options. It's really looking at that basket of services I spoke about. Because children are not removed during office hours. They're removed immediately. They're removed during holidays. They're removed during weekends. They really need emergency placements. So it's really about those four things Fiona mentioned, is about what is available, what can we do now, how can we work together, how can we ensure safety all along the process, how can we make sure that we maintain quality and that standards are met, and how do we do this cost effective, and how do we do this so that we are looking at this holistically, because the paper is really the start of the conversation. It's making our position very clear. Like Fiona said, we're not defending institutionalized care, we're defending a child's right to appropriate alternative care. And that's really the basis of this paper, firmly anchored within the Constitutional and the Children's Act mandates and regulations. So that's really, in a nutshell, what the paper is about. I know it's quite a long paper. I think it's about 13 pages or so, and I've really condensed it somewhat for your ease of reference. And Fiona did such a great job of going through it and speaking to us that I didn't really think it was necessary to go into the nitty-gritty. But what we can do is we will then share the slides, and we can have some conversations around it now for further clarity, or if anyone has comments, anything they'd like to add, I would like to open the floor, because it's probably more important that we speak about it and come to some kind of resolution about how to take this forward. Thank you so much.
Thank you very much, Annelie. I think what you said complemented Fiona's presentation, and I would like to now open the platform to the members of the task team to make any inputs that they may have based on our experience as we're working on the position paper, or any input that they would like to make with regard to this particular matter. So anyone, you may just come in.
I just want, sorry, Donald, I just want to apologize for my screen being so blurry. I'm not sure what happened. I'm more than willing to share my slides with, I'll share it. I'll put a link here in the chat. So I'm very sorry about the blurriness. I have no idea what happened.
Okay, that's fine. I actually thought that the blurry was on my side only. I didn't realize.
I'm also not sure what happened there. Really sorry.
Okay, no, that's fine. Yeah, we can make that available. Any input from the members of the task team? I do not see any hand at the moment. Oh yes, Professor Nixma. You are on mute. Please, Nick, you're welcome to speak. Prof, can you hear me? I'm not sure if Nick can hear me. Okay, we'll come back to Nick. I saw a hand from Mandy. Mandy, would you like to say something?
Yes, thank you, Donald, and hello to everyone. Fiona and Annalie did an excellent job of presenting the issues and the position of NACCW. And as I was listening, I was just reminded that nothing that has been put forward is new. You know, if we go back to the initial transformation of the child and youth care field in South Africa, what we presenting back to DSD is exactly what they presented to us at that time. And it just, for me, feels, you know, really sad for the children and families in our country that 30 years later, we're sitting with these issues that at the time we were also excited we were going to be able to, you know, to change, because a lot of what is, you know, being discussed in the presentations is what had been agreed to. So I think it's just important for new people to the field to realize that, you know, the way this has been presented is coming from a place where there had been a lot of research. NACCW were in the forefront of advocating for the continuum of care and what that actually meant, and the work of family preservation within communities. All of it is possible because there were pilot projects that were run, and they were run successfully, and there is still a lot of history in terms of expertise and knowledge resting in various organizations throughout South Africa that would quite easily, I say that in inverted commas, but who would be able to ensure that the continuum of care from one end to the other is working effectively. So it's exciting. And I think that the position paper as well as the presentation just capture it perfectly and emphasize the most important thing, which is children participating in what's happening in their lives, and also ensuring that there is a range of services that meets individual children's needs. Thank you, Donald.
Thank you. Thank you so much, Mandy. I think you said it very well. You know, if we continued from that time of the transformation of the child and youth care system, will be very far ahead at the moment. So maybe this could form part of the reminder of what we have committed as a way to provide services to vulnerable children who are in our care, especially who are coming to the child and youth care centers. Nick, I will try again now.
I think I'm on now. Can you hear me?
Yes, yes,
Okay.
yes. Thank you very much.
Well, I'm happy that my comment was delayed to hear Mandy, because it's connected to that. I have a concern based on experience in the United States, but also my knowledge of South Africa and experiences in Europe. This whole process began, as you know, with experience of in Romania, where, practically speaking, there was a problem with institutional care. However, my concern is that the stereotype of institution is going to prevail in the decision-making process in the Department of Social Development. That is, that all institutions are, by their very nature, bad. And that is not the case. I have worked in some bad institutions, but I've also worked in some very good ones. And I think the paper has been very clear about what constitutes good care. I would also stress that if there is an action to end institutional care, that is not only abandonment. My opinion is that's actually institutional child abuse, because the public sector would be actually engaging in actions that abuse children. So the position paper is very clear. I commend Annalisa in work on that, and the rest of the group. And I hope that the Department of Social Development here's this very rounded presentation that's been made. Thank you.
Thank you very much, Nick. Yeah. We are hoping that they will realize that when they receive this paper, and then for everybody else, we are hoping that they will create an opportunity for a meeting where we can present this as well as have a discussion with them. And
Yes.
I think all of us are saying we would like to be part of assisting to find what they see as a problem. We need to find a solution for that, and we need to do that together, as presented by Fiona. So thank you very much. We will now open the platform to all the attendees. So anyone now, if you've got anything to say, please indicate, and then we will then provide you with the platform to make your input. Nick, do you want to say something further?
No, Donald, I don't know how to lower my hand. Sorry.
Okay, thanks. Okay. I see we've got 2 comments that I have seen. I'm just checking if there is any other comment. And the 2 comments that I saw from Alphonse, wonderful and clear presentation by Fiona. Thank you, Task Team. And then there is another comment that's saying, I love the level of stakeholder engagement in this. Contrasts starkly with how DSD has approached deinstitutionalization to date. That comes from Sue. Those were the 2 comments that I picked up. Yes, Claricia?
Good afternoon. Just a comment to say, like, I really appreciate that the NACCW has done this and gone this far, because as much as we believe that each young person or child belongs within a family setting, circumstances doesn't always allow that. And so to just go ahead and deinstitutionalize and close all CYCCs, I don't think that that's the right decision. So I'm really grateful that the NSCCW is doing this. So thank you.
Thank you very much. Thanks, Claricia. Any other comments? Jonathan? Jonathan, you may unmute and speak. Jonathan, if you are speaking, we can't hear. Please unmute. Okay, while we wait for Jonathan to get sorted out on that side from the Southern Cape, let's see if there is anyone who wants to make an input. I don't see any other hand. So we'll just indicate how we are planning to move in terms of this process. So the next step now, we have not seen any input that is giving us anything new to add on to the paper. So the task team will then move to the next step in submitting the position paper to the Department of Social Development, to the Minister of Social Development in particular, and then also a request for a meeting with the minister. And then we will inform the sector as things happen. And we will be calling another meeting to give you feedback as we receive the feedback. I see there are two hands. Jonathan, I'll give you an opportunity again. Let me see if you're available now. Amanda?
Good afternoon, colleagues. Thank you for a well-researched, informed paper. My comment will be the comparison between state-funded CYCCs versus the NPO-funded CYCCs, because the deinstitutionalization might take the route of starting with NPO funded, because those are the less resourced CYCCs, and then the continuum of care or is not as it should be. So maybe the paper need to include that while the department is working towards deinstitutionalization, the quality of care should be standardized regardless whether you are a state-funded or NPO-funded CYCC. Resources like the human resources that need to be employed, the auxiliary child and youth care workers and qualified child and youth care workers, and infrastructure, the whole lot that is listed under the norms and standards. Then if we are really pushing towards it needs to remain as the needed alternative care, then resourcing should be standardized. Thank you.
Thank you very much. That's a very good point that you have made. It is appreciated, and the task team is going to look into that suggestion. And then, Jonathan, you seem to be having a problem with your mic. Okay, you indicated that I touched on what you wanted to ask. So thank you very much. We seem to be fine there. Okay, so this will be the end of part one. And then we will then move on to the next item. The next item on our agenda is the assessment of qualification of child and youth care workers. We would like to report to the sector that NACCW held a meeting with the Department of Social Development some 3 weeks ago, in which we continue to deliberate with them on the challenges facing the child and youth care profession. And they seem to be listening to us now. And one of their requests was that they would like to understand the sector better. They want to understand how many child and youth care workers are on the ground, how many auxiliary child and youth care workers, and how many support staff are in the child and youth care centers, as well as NPOs that are providing child and youth care work. This goes beyond residential child and youth care programs. So any program that is providing child and youth care work, they are putting together a database of that so that it can inform the decision, also assist with planning of the sustainability of the child and youth care sector. There is a form that we have circulated, and I am going to request Randy to attach that form on the chat box. So please download that form on your site, complete it, and then it's got the forwarding details right at the end to the Department of Social Development. We also request that you copy NACCW so that when we engage with them, we ensure that whatever documents you are sending with them have been received and are included in their database and whatever plans that they are working on. So that is what we would like to indicate. Randy, if you could please, are you able to attach that document on chat box?
I don't know. We're not able to put documents on the chat box, but I can eventually share a link. I just need to try and upload it somewhere.
Okay. And Randy, if by the end of this meeting you have not been able to establish that link, can they access it from the NACCW website? Is there a way that you can make it available?
Yes, I can, or I can share the link on the WhatsApp group, and everybody can just share it to the people that was on here as well.
Okay, so we'll do that. If by the end of this meeting, the link is not available, we'll send to all the contact details that we have, all the platforms that we have, and you will also be able to access it from the NACCW website. Thank you very much, Randy. I will now hand over to Sam to extend a vote of thanks to the attendees in the absence of Gert. Sam? Looks like we may have lost Sam. Can I request that any member of the task team, if you could please step in and extend a vote of thanks to the attendees, please?
I'd be happy to step in and do that, Donald.
Thank you.
The task team appreciates very much your participation this morning. I'm sorry, this afternoon, and looks forward to your continued involvement and support for the position and the recommendations of NACCW. I want to thank personally the members of the task team who worked so hard on this and produced such an excellent position paper. And I want to commend all of you for participating this morning, and again, for your interest and support. Thank you.
Thank you very much, Nick. You were correct. It's actually morning by your side, just after 6 o'clock in the morning. And it's just after 12 noon on our side. So you are correct. Thank you very much for also to you for waking up so early to join this webinar. We really appreciate that. I'm now going to hand over to Fiona to do the closure.
Okay, good afternoon, everyone, again. And thank you so much for being here and for participating in the second webinar. Just to get feedback, but also more importantly, to also guide us if there were any more input that was needed to go into our actual final document. I do hear very clearly Nick's comment around that institutional child abuse, which could be incorporated into our conversation in the position paper. And yes, that key component about always the debate around state versus NPO funded services. In some way or the other, we'll try and incorporate that as well, because that is a key component of when we're reviewing and looking at reducing funds. Department need to review also the cost to care in terms of their services rendered to children in need of care. So I do want to say thank you for that feedback. As Donald has already mentioned, the next step is for the task team just to review, put together the document and finalize it. And then we would be ready to communicate directly with DST in terms of setting up or submitting our paper through to the minister and taking it forward in terms of further meetings. What Donald has reverted to was a meeting that we did have with National DST. So we are acknowledging at the same time that they have in recent times acknowledged NACCW and sat down with us as a stakeholder in terms of the services rendered to children across the country. And one of the key things that Donald's referred to in terms of this survey that we are sharing with everybody, it is extremely vital that as many of us in the sector respond to that survey. We know how in the NPO sector, we can be very lethargic in completing documents and submitting any paperwork or surveys or stats when we need it, especially for ourselves and our own advocacy. So from experience, we would like to emphasize to everybody, please, when you see the survey, although it is a DST document, we had hoped to have a further meeting with DST to revisit some of the concepts in it. But we're also fully aware that a department document is not easily changed. So we would rather make the effort to work with the document and submit as much information as we can. Because one of the key things that the department threw back at us is that when you talk of your membership and when you talk about workers in the field, who are you referring to and at what capacity, where are they sitting, how many of them are child and youth care workers, how many are sitting as auxiliary workers in the field, because we had a proper agenda. And in that agenda, we spoke to a lot of key components and aspects related to child and youth care sector, coming together around training and professionalism of child and youth care workers and various challenges linked to all of it, including the stipends and the salary component to it. But what we were faced with is very clearly being asked by DST that you need to also gather information. So that we can look at that information and have a better understanding of what's going on in the field. So when we put this plea out to you as NACCW, we are saying, please take this document and share it widely. There is a deadline of 31st August for us to submit the survey back to DST email and to our NACCW email that's being shared on the group chat right now. But please do share this document widely and encourage people to register and complete it as soon as possible and submit. The more quicker we can get more of our sector to complete it, the better it is for us, because before we sit down at another meeting to engage in the broader issues related to the sector, we would like to know that we have made a complete big effort across the country in all the provinces to submit this document, because it will help us tally information across provinces and be able to say what is going on with us in the sector broadly. So the quicker, the better we fill this information. So that's my urgent appeal to everybody. When we close today, we will be finalizing our position paper and sending it off to the minister as a start and setting up a further meeting to continue the discussions with the department around deinstitutionalizing. And secondly, we would give ourselves a timeline of 31st of August to be completing the survey that needs to be done. And we will be putting a lot of emphasis on completion of the survey in the next week or two so that we can all meet the deadline and across the country come together to submit our information so that this information can be tallied and we can pull from it what is happening in our sector as well. So it's not as much as we would want to. If we were going to put our own questionnaire or survey out, we would have probably done it differently. But at this point, it's what the department is asking for, and we'd like to make the effort to submit so that it helps us in strengthening our discussions and our advocacy with them at the level that we are sitting with them at the moment with. So we do want to show them the effort that we're coming forward, and that we as a sector can come together as one in terms of sharing and putting information for them. So I want to thank everybody again. I think with that, Donald, if you don't have any other further comments, I would like to close the meeting and just remind everybody that we're not sharing the draft document at this point purely because we want to finalize it, and we do need to present it first to DSD before we start circulating it out there in the field. So please bear with us on that. And we're looking forward to further engagements with you. We're encouraging you all to fill the survey at this point for submission. And then as soon as we start with our engagements, we would be able to set up a further webinar where we can bring back and share more feedback on progress made on this significant issue that affects all of us. With that said, I want to say thank you once again to everybody, to all our guests, and to all our well-wishers and friends and members of the task team for putting so much of effort into putting together the position paper. And thank you, Donald, for leading this process and guiding us through it as well. We appreciate all of it. Thank you, everybody. Wishing you well, and we will chat with everybody soon. Donald?
Yes, thank you very much, Chair. The one last thing is that we encouraging child and youth care workers to register as members of the NACCW. If you are not a member, please do register. Very soon it will be at a point where only members will be benefiting from this kind of platforms. And you can access the registration form from our NACCW website and complete the form. Membership is 50 Rand a year so far. So we encourage you to join so that when the time comes that only members have got access to this kind of platforms, you are not left out. Thank you very much.
Thank you, Donald. I think we declare this meeting closed. Thank you, everybody.